Yes.
Now, how do I get this icon?
Slideshow.
Slideshow, wait.
So once again, good evening, everyone, and hope you all are safe and keeping yourselves engaged. As a part of the Masterclass series, today we have Professor A.K. Kumar. And so without much ado, I would like to hand over the dice to Professor Kumar, who's going to be delivering a masterclass on social impact and management, an odd couple. Over to you, sir.
Thank you very much. And for all of you who have signed in, it's a real pleasure to be able to talk with you, though it would be very different if we were face-to-face, meeting face-to-face. I just want to, just by way of background, say that, I was a student at IIM Ahmedabad many, many years ago and learned a lot about management and the principles of management. But then, as soon as I graduated, I set up, four of us started a non-profit management consulting group that started working with the informal sector, the non-formal sector, the development sector, or more broadly, the social sectors. And I found that the training that I got as a manager to become a manager in the IIMs was useful, but not entirely relevant because we just did not know the social context. Partly a reason why it prompted me to go off to Harvard and do a master's in public administration and my PhD in economics. And when I came back, I really was able to see the value of management as it applies to the development sector. So I want to share a few of my reflections on this social impact and management, given my background, and just reflecting. These are some random thoughts that I put together to share with you. So let me start by saying my presentation is in 5 parts. We have to start with the backdrop of economic growth. Even now, if you look at the COVID, the spotlight is all on economic growth. The latest forecast for India says zero economic growth. So there's a considerable amount of discussion on growth. Then I want to move on to talk about what has been the social impact, how do you think about development, and why there is a need to go beyond conventional management. And finally, I want to relate what we are talking to with the COVID experience and what it reveals. So this will be about half an hour is what I'm trying to limit myself to, and I hope I do that. Okay. So as I was mentioning, there is a very strong spotlight on economic growth. And for any country, especially low-income countries or low-middle-income countries like India, growth is important because it raises standards of living, it brings in additional revenues for the government with which we can invest in health and education, etc. And it also goes on to solve problems of public debt and borrowing and so on and so forth. So growth in itself is not a bad thing and is needed. But people have questioned the preoccupation of policymakers with economic growth, which has unfortunately become the single indicator of measuring progress in society. The first problem with economic growth, some of you have heard of this, is that it may not capture all aspects of life we cherish. And there's a very famous quotation that I'd like to read from Robert Kennedy, who said that the gross national product, I'm trying to see how I can read yeah, okay. The gross national product does not allow for the health of our children, the quality of their education, or the joy of their play. As you know, the GNP is a monetary measure of the market value of goods and services produced in a country. So it's actually commodity production multiplied by the price. It does not include the beauty of our poetry or the strength of our marriages, the intelligence of our public debate, or the integrity of our public officials. It measures neither our wit nor our courage, neither our wisdom nor our learning, neither our compassion nor our devotion to our country. It measures everything, in short, except that which makes life worthwhile. And it tells us everything about America except why we are proud that we are Americans. I raised this, and I think it's a very profound statement, because what you're seeing today in terms of how much people are able to do in terms of social distancing, in terms of conforming, in terms of going out and helping people in distress because of the COVID pandemic, are all features of society that can never be captured by economic growth. The second one is, of course, this whole phenomenon. It's a macro phenomenon, but also at the household level, where we find that income expansion may not necessarily translate into well-being. And some of you might be familiar with the development economics literature, which talks about jobless growth. This is a phenomenon that we have been experiencing in India as well, so it's nothing new to all of us. Ruthless growth, here it refers, the term is used when you have economic expansion, but with accompanied by growing inequalities. That is, income accrues and wealth accrues to a small minority at the top and a majority at the bottom, or why 70–80% of the population does not get the benefits of growth. Third is voiceless growth, where you find that only those concerns, there is growth, but only concerns of the more vocal groups get picked up and addressed. And many of the concerns of smaller groups, lesser known groups who don't have the voice or the representation go unheard. So there is a certain unfairness in just pursuing growth for growth's sake. Rootless growth, this of course is another term in the literature that talks about seeing how growth can impact different cultures and contexts differently. So we may not really be rooting for more growth in certain environments which may not be able to actually take so much of environmental damage or cultural damage or any harm to contexts. And finally, of course, there's the idea of futureless growth, where you find that growth is happening much to the destruction, accompanied by the destruction of the environment and nature. So a lot of the climate change issues that we're observing today are actually man-made or human-made problems. And that again is the trade-off that we are facing. So having said all this, of course, economic growth is necessary and it does have a social impact. So let me move to the second part on what has been the social impact. So a traditional view is to say that social impact is assessed by the improvements in standards of living. And if you look at India, certainly so, real per capita incomes have been rising rapidly, doubling and quadrupling in the last 10–15 years. It has led to a very strong decline in income poverty. Even an indicator called multidimensional poverty that looks at non-income measures of deprivation also shows remarkable improvement. And at the same time, you find there are marked improvements in living conditions in terms of households which have houses or pakka structure. It says the latest data says almost 80% in rural areas and 95% in urban areas have pakka house structures. 100% rural road connectivity, electricity in every village, 100% open defecation free, and we can go on and on and on. Some might not believe these numbers, but we are getting there, and it's only a matter of time, maybe a few more years before we reach actually sustain 100% coverage of basic social services and infrastructure and amenities. So if you look at how people view social impact, I just picked up two pictures. I mean, there's no significance, but 20–30 years ago, if you saw that kind of a house, and now you see a middle-class family with these comforts, with television and sofa sets and all that, then this has been made possible by economic growth. I think that's something that we must understand. But then the question is, if you're not really pursuing economic growth, what is it that we should look at? Because income is only a means, and with income, I can do many things. But income alone cannot guarantee what we are looking for, whether it is equality, whether it is better non-discrimination, or a life of dignity. So when you talk about social impact cannot be measured in this conventional sense by looking only at improvements in standards of living. And so we say that social impact ought to be assessed by an expansion of opportunities and freedoms that people enjoy. This is a broader definition, and therefore economic growth should contribute to social impact, and social impact we must talk about expansioning of choices or widening of choices. And one of the finest quotations that comes to mind is the one by Karl Marx, who was asked, what do you mean by widening of choices or expansion of opportunities? And he says, replacing the domination of circumstances and chance over individuals by the domination of individuals over chance and circumstances. Such a powerful, simple statement that says that what people are really looking for is to get over a sense of helplessness and powerlessness. And every time you find yourself stuck or cornered, you really feel that sense of insecurity and helplessness. And so if you really talk about social impact on a majority of people, it is measured by the extent to which opportunities have opened up for these people not to feel trapped and helpless. So it's very people focused. Similarly, Professor Amartya Sen talks about expansion of freedoms, and his book is called Development as Freedoms, as many of you may know, and he defines it as in terms of an expansion of freedoms. It could be economic freedoms, social freedoms, political freedoms, cultural freedoms. And interestingly, he defines development. He says, what is development? And this is a quote from Professor Sen, who says, development requires the removal of major sources of unfreedom. And the sources of unfreedom that he talks about are poverty as well as tyranny, poor economic opportunities as well as systematic social deprivation, neglect of public facilities, as well as intolerance or overactivity of repressive states. So if this is the context, so therefore we are saying that anything you want to, any intervention you do, which has a social impact, should ultimately be measured in terms of expansion of opportunities and freedoms that people enjoy. Let me say a few things when you talk about development and thinking about development before we enter this arena of management. And I just put down a few things. The first important thing is in this field of development, I think most of you might be already there or might be interested in joining the sector. The first thing to recognize is what you see is not what you get. And this is so important to keep in mind all the time when you're entering the field or going somewhere for any kind of an evaluation or an assessment or a needs assessment or anything like that. Because today, what has happened with economic growth is you find such a tremendous improvements in the visible standards of living that it has created a false sense, an illusion of equality. So if you come to Delhi, for instance, in the urban slums, you will find a young man is wearing the same kind of t-shirts and blue jeans and sneakers that you are wearing or my son is wearing. So in a sense, if you line up five young men, it'll be very difficult for you to say who is from the slum and who is from a middle-class family or even a rich family. So the fact that you have access to clothes and look similarly dressed does create the illusion that they're all equal. Or take the case of a young woman staying in a slum who's able to now buy shampoo. By the way, this marketing to the bottom of the pyramid has been a great success, but in one sense, you can buy the same shampoo for 10 rupee a sachet, which you find film stars using. So you suddenly get a sense, or you can buy Maggi noodles for your kids and cook it in the slum, just like you would see in a TV ad where a mother in the middle class is making it for her children. So what it has done is this expansion of goods and services or economic growth is to create this false sense of an illusion of convergence and equality. But it is true in the space of commodities. But there is a divergence in the space of opportunities. And there is a growing concern that the opportunities that young people have in the slums are nothing compared to the opportunities that my child or your parents have been able to give to you. So what you see is not what you get. The second one is, of course, that there are multiple realities, unlike in the physical sciences where there is only one reality. The temperature in the room is fixed at 24 degrees, no matter whether one group says they're feeling hot, the other group saying feeling cold, but the reality is the same. It is fixed. But when you come to the social sectors and the social realities are multiple. And so whose reality are you really talking about? That becomes extremely important. And so when you enter the field of development and you're looking at designing interventions and management programs that reach different groups, you really have to listen to different groups, design programs that are sort of customized to the needs and realities of different segments of society. And that is actually quite a challenge and one of the challenges that managers face in this field. and whose voices get listened to is extremely important. Otherwise, as the political scientists will tell you, there is such an elite capture of resources that very many vulnerable groups get left out. Third, you have to deliberately look for unfreedoms, because on the surface of it, you may not find it. For example, if you look at gender discrimination in society, you may not observe it even in your own families or in your friends' houses and so on and so forth, but you do read a lot about gender discrimination and how boys get preference over girls. Sometimes you feel that it happens to the other and not to us, but there are nuances and nuances in the understanding. So let me give you a very interesting example of this unfreedom. And I was looking at marital freedoms of young girls in Bihar. This is a survey done by the Population Council in 2015, 2016. So it's not very old. So in the survey, they found that 44% of the girls were married before the age of 18. Which is quite shocking in today's day and age. So you have economic growth across the country, you have access to television, you have improvements in your houses, you have mobile phones, you have cars or vehicles or scooters that you might be driving around. But the reality is that this kind of economic growth or economic income expansion hasn't made much of a dent. Things are improving, by the way, but very, very slowly when it comes, for example, to marital freedoms of young girls. I picked up the Bihar one because this is a recent survey. The other surveys for other states are 10 years dated. 60%, 61% were not even consulted on the choice of husband. So the parents basically decide when you will get married, at what age, and to whom. And what is surprising, and this sometimes we may not realize the reality of many people's lives, that 75% or 77%, more than 3 out of 4 young girls were meeting their spouse for the first time on the wedding day. So I say this because while you have economic growth on the one hand, the social impact is not felt the way one would like to feel, that yes, the young girls have the same kind of freedoms that many of your sisters and your friends that you know enjoy in society. So if you're talking about managing or designing interventions or programs in the development sector, then we might have to think of broader goals, not just, let's say, doing a cash transfer program for the girl child, but taking that a little step further, saying if we do indeed transfer cash to girls at different stages in their life from 0 to 18 years, in what way does it give them greater freedoms? In what way does it reduce discrimination and so on? And lastly, I've said understanding the other, because many times, in fact, I've changed the title, I think. Oh, I didn't change the title here. It's an old slide. I was going to rename this Making the Invisible Visible. So just like I said, many times we don't notice the unfreedoms. Sometimes there are many things that we are not noticing. I just put this slide, which is a very telling slide on India. Very few people want to talk about it. And this is attitude towards domestic violence. So in the National Family Health Survey 3 and 4, the 3 was done in 2005, 2006, 4 was done in 2015, 2016. There is a question they ask both men and women in this age group of 15 to 49. Do you agree that a husband is justified in hitting or beating his wife? And look at this very interesting thing. In 10 years, between 2006 and 2016, in both years, by the way, a larger proportion of women say that a husband is justified in hitting the wife than men, which itself is a sad commentary on how freedoms are curtailed in the society by mothers themselves, who teach young girls how to behave and how to groom them in this overall context of patriarchy. But in 10 years, the attitudes of these women and behavior patterns hasn't changed, because from 54%, it has come down to 52%. Yes, a lower proportion now of men in 2015-16 report, but there are several reasons. There may be several reasons why this has come down. Part of it could be just the greater awareness of the law that prevents domestic violence. There's a domestic violence bill that has been passed, and there are serious strictures and penalties if you get reported that you're beating your wife. So I bring this to say that when you're talking about social impact, yes, designing economic interventions, programs, income generation, etc., is important, but we should be very conscious to take that a little further and say that we cannot stop with just income expansion and growth. Income and expansion to ensure that people have greater opportunities, greater freedoms, and that is the extent to which the manager will have to stretch himself or herself when it comes to working in the development sector. The final point I want to talk about is working with limited evidence. Unlike in the corporate sector where you have a lot of data, real-time data, a number of issues that we're talking about, there is very limited evidence. And I think the COVID experience really tells us how we are struggling, how as a country we are struggling with real-time data on coverage and testing and what is happening. Even now, the limited data, and it's improving, by the way, day by day on infections and deaths, we still, for example, may not find out what is the socioeconomic background of these people who are getting infected. Are the middle-class families and are getting more cases of infection reported there, or is it really the poor people? What is happening in the story? So very many times you have to operate in this development sector with limited information. And so that is a big challenge. And of course, just on a lighter note, we say that while literature and all of us push for evidence-based policy making, the practice seems to be policy-based evidence making, regardless of the government in position. You announce a policy or a program, and then you get it evaluated a year or so later and show that extraordinary results have been achieved. So one has to be very careful, and I say this because part of the noise around data and evidence has to be dealt with much more carefully when you come to the social sectors. So just to summarize, I'll say that as a manager in the development sector, you have to form a very good understanding of the realities and complexities that shape the daily lives of people. So you cannot let people slip out of your vision when you're planning to do something for them. I've got two more sections, and I think I have about 3-4 minutes. I'm well on time. When you come to the development sector, you have to go beyond conventional management, and that's what I've been hinting at, take that extra leap forward. Let me give you an example. When I started working early after my IIM Ahmedabad, there used to be a lot of income generation programs for and cooperatives that were working with handicrafts and handlooms and small income generation projects. So we would often be asked to say, can you go and design management systems for them? And can you go and help them in expanding their markets? Can you do a proper costing of their products and help them how to sell more and get larger markets and therefore larger incomes? And we used to do that with a certain amount of passion. But at that time, what it did not strike us was that income expansion or selling more cannot be the end or the goal or the mission with which a social purpose organization or an NGO works with communities. They have to take this a step further and ask the larger questions. Yes, your income perhaps has doubled in the last 5 years from selling some products, but how has that translated into greater opportunities and freedoms for, let's say, even young girls or women in your society? How free are they to step out of the house? How free are they to meet their friends? So you can measure various things in terms of social change and change in behaviors that would really push you to say that it's not enough for me to do the costing, marketing, branding, and sell the products. I have a larger obligation to improve people's lives, measured in terms of the opportunities and freedoms. A more contemporary example is if you look at the public distribution system under the National Food Security Act. In the last 5-6 years, there's been extraordinary improvements in the management of the public distribution system. So all the traditional leakages that we heard of, the problems of fake ration cards is gone. It has been streamlined. There were problems of inclusion and exclusion. That has been minimized to a large extent. There was a problem of leakage by the trucks. The trucks would leave with 100 kilos and reach the service point at much less quantity. That has been fixed by GPS systems that track the movement of the trucks. So a lot of technology and management has been used to ensure the streamlining of the public distribution system. And whatever may be the remaining problems of Aadhaar cards not matching or the fingerprinting not working, etc., those can be fixed. But we should not lose sight that the National Food Security Act was instituted to ensure food security and improvements in nutritional status. So the question is, yes, you have a fine public distribution system, but how effectively is it contributing to reducing hunger and improving food security and improving nutritional well-being? And if you lose sight of that problem, then you get stuck in this realm of techno-managerial solutions that really don't take you very far. So if you're a manager in the development sector, and that's why I keep saying when you talk, the social impact of management interventions has to be staring you in the face every minute. Let me come to the last point, slide, and this is where I'm going to sort of sum up and repeat some of the things. We have seen this COVID virus, and I think all of you must be following this very closely. There are lots of efforts by the government, and we must give credit to government and some state governments like Kerala, which have really gone out of their way to minimize the suffering of people, not just on the health side, but in the economic loss of livelihoods as well. And many states are trying. I think the central government is also trying. And the effort with which the government sector, the private sector has come together for the immediate manufacture of PPEs, sanitizers, gloves, masks is quite remarkable. So in a crisis, they've all come together and tapped the potential, management potential of the private sector and the public administration to deliver some things. But if you look at the lessons from our point of view, which I would say is sort of civil society or social purpose organizations or development thinkers and managers in development, the first thing that stands out is that the managerial actions without keeping interests of people in mind can be catastrophic. And if there has been any criticism of this government, it has been that the lockdown was announced very suddenly. There was very little preparation or information and preparation, and many people were caught off guard, including state governments. So that has really been a setback, and you might be seeing and reading a lot of the hardships that migrant workers not being able to go back are facing, and so on and so forth. So any kind of managerial action that you think, you have to keep the interests of people in mind if you want the intervention to succeed. Second, we also find that we don't hear of very many NGOs or social purpose organizations that are actively partnering with the government and others to help in the COVID case. I mean, there are cases of small groups providing food, or some charitable or religious organization providing food packets, but those are very few. And that itself is a comment on India. Of course, the extent to which the state will partner with civil society organizations or social purpose organizations, there is a political question. But in general, if there is no necessarily an adversarial relationship between the two, one would expect that by this time, 50, 60 years later, there would be some large NGOs that could make an impact on scale. Bangladesh is a classic case where BRAC and Grameen Bank operate on a scale that is not there in India. So today, the reach of civil society organizations and NGOs or social purpose organizations is quite limited, even though the role they have to play is an extremely important one in a crisis like COVID, where reaching people and communities that are difficult for the state, it's impossible for the state to reach all the needy. They will reach only some of the needy, and filling that gap in the last mile is a primary goal or responsibility of social purpose organizations. So that has not happened. And as I say in my third point, it's largely because of the absence of professionally trained managers and leaders in most NGOs and social purpose organizations. And this is why I feel that, professional training to think on scale, to think big, to think of impact, to bring the best in terms of technology and management skills to bear on social problems and situations of the kind that we are confronting today is really a big gap in our society. So let me end by saying, that the need of the hour, by the way, this is an old slide, that's why the spelling mistake is there. The need of the hour is to get the match right between professional management and a good understanding of development that sees the goal as not being efficiency, not just being promoting efficiency in the delivery of programs, but takes it a step further and addresses goals of equality of opportunities, expansion of freedoms, and reducing the insecurity, especially in the lives of poor people. So that is what the purpose of management would be. And the oddness or the odd couple, we wouldn't be calling them the odd couple if we get this match right. Thank you. So let me stop here and open to questions, comments. Adil, you're going to sort of moderate. And
Yes, thank you
thank you
so
so
much
much.
for this
Thank you
session.
so much for listening.
Very, very engaging session and really contemporary. So we have a lot of questions lined up. So, sir, what I'm going to do is I'm just going to, club similar questions together and then pose them to you, and then you could answer those questions.
Yeah.
So, the first question that I would like to, is by.
Yeah, go ahead.
Yes. So the first question is, what are some of the risks that are associated with quote unquote managing and taking a so-called quote unquote management approach when it comes to the development sector? How can we mitigate those risks?
Okay, should I just answer this? Like,
Yes.
shall we do it one by one? Yeah. And
Yes.
I'll keep the answers brief so we can get more questions in. So let me, I talked about some of the risks associated with management and the management approach. One of the problems that I have found is the problem of trying to design interventions that work in complex environments. And it's a very risky job for the simple reason that you have to actually, as they say, you have to design multiple interventions for different groups. So a unified approach may not work. So that becomes a real challenge. And if you try to push a unified, standardized management plan, it just fails. And so I think one of the lessons that we are learning increasingly is how do you take the conditions, local culture and the context, factor that in, build on the local knowledge and capacities of communities. The risk is also minimized in situations when there is a sense of ownership of the intervention by the group. So as a manager, you cannot just design an intervention, go and try to implement it. How do you ensure a buy-in of the communities that you're trying to help? In fact, much of the analysis today on why government programs fail is, or centrally sponsored schemes are failing, is because there is that lack of sense of ownership. So a manager in this area, in the development sector, has to really deal with things that are very unconventional, ensuring effective ownership, effective buy-in, keeping a lot of time for communicating with the families, what you're planning to do, taking their suggestions in while designing the intervention, making it customizing interventions for different groups, and so on and so forth. I think if you do that, then a lot of the risks can be mitigated.
Thank you, sir. So we have a lot of questions as expected about the current COVID situation. So a lot of us would like you to look into that crystal ball and tell us, about the post-COVID scenario. But mainly the question here seems to be what will be the effect of COVID on the economy, and how, what will be the economic post-COVID scenario be like, and how as a manager in the development sector, how does one mitigate that?
Yeah. So, it's actually, as most people will tell you, it's very difficult to make any kind of prediction at this point of time because of the huge uncertainties and the lack of information that we have. We just have no idea at this point of time how the COVID pandemic is going to unfold. If we are lucky, we have seen the end of it. And we will continue to see the end of it by September, October. That's a cheerfully optimistic situation. But you also hear that there is a possibility that it could spread, and even this effort now to partially open the economy from 20th of April. They're testing the water, so it's really not easy. But having said that, I think and I think, like I said, for me, the prediction on what will happen to economic growth, whether it's zero or it'll come down negative and so on, those are secondary questions. As I said, we have to really look at the impact on the livelihoods of a large number of workers who are in the informal sector. And there are 3 or 4 actions that are immediately needed in the short run, and 3 or 4 actions that are needed in the long run. In the short run, there is no question that food has to be given to people free and a larger quantity. So if in the, and it, I underscore the point of free, because even most families in rural India or elsewhere in even urban slums, because they are not earning, they're so dependent on a daily cash economy that they cannot even afford to buy the subsidized wheat of 5 kilos per person that they were originally getting. So to make it 10 kilos is important, but to give it away free is even more important at this point. Second, I think the food question is again important, because if you've seen these pictures of people lining up to get food packages, it is really very dehumanizing and demoralizing. And what it does to the self-respect of young people or anybody is quite devastating. So having community kitchens going where people who want food can go and get food, again, free, I underscore free, because cash and incomes are a very, very, very serious problem. The second one is you can't just give wheat and rice and say that much of the food problem is sorted out, because I've been underscoring the importance of cash. So we definitely have to give cash transfers. That's what many people have been saying. We can argue about the amount, but whatever channel is there, there has to be a mechanism of continuously transferring cash to many deserving people. And what I would argue that in addition to what the government has done, I would take the Narega workers' bank accounts, because you recall that the Narega workers were the most desperate people who wanted to come for work. It was a universal program with self-selection. So I think Narega workers' bank accounts should also be, they should be recipients of cash transfers, unconditional cash transfers by the government. So I think food and cash would be 2. The third one, which I think is equally important for us, is to prepare quarantine centers we have to be prepared in many cities and class 1 towns and class 2 towns and bigger villages. There could be even stadiums, because you will find that stadiums are often well equipped with water and bathrooms and toilets. So we cannot slip up on building quarantine centers as being prepared for the crisis. And lastly, in the terms of the immediate short run, I would say that we need to be very careful about hospitals. Don't forget that normally on an odd day, those of you who have gone by Safdarjung Hospital or AIIMS will see large crowds of thousands of people queuing up for treatment. Now, if people start going to the hospitals, then you need to have a very clear, some hospitals have started doing, of segregating, that you will be screened first for COVID and then only allowed into the hospital. And if we don't take that kind of care for health centers and hospitals, we might have a second crisis on hand. So this is the short term, but this is also an opportunity, I think, for us to reflect on 3 or 4 long-term interventions that we need to do. Certainly health. I think COVID has exposed what many of us have been saying for years, the underinvestment in health services of India. We need to really strengthen public health services. And you see today that the lead in trying to combat the pandemic is coming from the public sector and the government health workers and the government doctors and so on. So we really must take this as an opportunity to increase the public sector capacity and availability of health services. And so that is one. Second is, I think job creation is extremely important. We cannot think of small measures. We need a blueprint of about a 15-year blueprint. It's a long-term blueprint on how to generate jobs and where these jobs will be created. But my point is, even if we do that kind of a planning exercise, we have to address the root cause of a lot of this unemployment, which is the broken education system, both the school system and higher education system. So we cannot skilling, no amount of skilling can be a substitute for good quality school education and college education. So this is again an opportunity to invest in basic schooling as a prerequisite or requirement for enabling people to get jobs. And the last, I don't know whether it's the third or the last, but the last one is to also revisit the question of a social protection scheme, social security scheme. The government has considered many options in the past, but this is really an opportunity to offer some tangible benefits in terms of social security to a large majority of informal sector workers. So those would probably be my long-term interventions on health, on education and job creation, and on social security.
Thank you so much, Professor. So there's one more question, and this is regarding the, very closely related to the topic of our masterclass today. It is that we talk about evidence-based policy action, but authenticity of data is always a question, in terms of the quality of the data that people gather at this time. So the question mainly being that how does one marry the management and the social sector? Traditionally, these have been very polar,
Yeah.
but now with the new forms of development management coming in, how does one marry this and get the desired impact?
Yeah. You know, there is so much information that is gathered by the state administration, whether it is in health, whether it's education, but very little of it is used. Even today, if you look at the NREGA website, you have extraordinary amounts of data that the government puts out. Yes, it may be good quality or bad quality, but part of the thing is for us to test. If in fact, that's what the education DICE data did. It started putting out block level data and school level data. So if you're a researcher going there, you can easily check whether this is true or not of the government school. So I think the need for using big data to discover patterns, to bring in new technology for real-time data collection. In fact, this COVID, I get almost a survey result every other day. A survey of so many people done. Now with the GPS, geospatial tagging and so on and so forth, there's so much potential. And the reason why we are struggling in the social sectors or the development sectors is, like I said, the absence of effective capacity and competencies to handle this. The governments are not able to do it because many of the civil servants are not trained to do this. It's quite a technical job, and so we are stuck over there. So I really feel that when you're talking about the Indian School of Development Management, one of the outcomes the goal for a graduate who comes out of this program, 1-year program, should be level of comfort with the use of technology and data for decision making in the social sectors. And I completely agree that that's why I said, people just take decisions on hunch. I think this will work. And I don't want to, there's so many examples I can tell you where ministers and senior bureaucrats just come up with ideas and they're their pet ideas and we go ahead with it and do it. And there is no serious assessment. There is no benchmarking. There is no evaluation culture which says whether it's working or not working. What are the lessons learned? Whom does it benefit? Why? And so on and so forth. So data is also linked to the whole issue of an evaluation culture, which is quite missing in the social sectors. Not just in government, but I'd say also in the social purpose organizations and the non-governmental organizations. Very few of them would undertake rigorous evaluation as necessary for learning and accountability.
Thank you, Professor. I think we have time for two more questions. So the one that actually caught my eye is that what does it take to have a long and sustained impact in the design framework that would bring transparency in the in the social sector and impact human lives in the long term?
Wow. Yeah. So I think this issue of transparency and impact are and design are very well linked. And this is what I've been trying to say from the very beginning, that in designing such interventions, you have to consult people. And it is because we are talking about impacting the lives of a large number of people. And so getting their views and getting what they have to say, what their priorities are, would almost be the starting point. Uh, the second, I'm going to jump a little bit because of I don't want to spend too much time. But yes, for me, collaboration, partnership, engagement of the community, building a sense of ownership is important. I also say that because closely linked to that is ensuring effective implementation. And if ensuring effective implementation of a well-designed program requires multiple stakeholders to be involved and have a stake. They're called stakeholders. Now it has just become a term for partners. But when you say stakeholders, they do have a stake in the program and in the intervention, and they will have to play their small roles in ensuring that collectively the intervention succeeds. And so I think the need for transparency, openness, collaboration is absolutely important to ensure effective implementation. So if you have any kind of community monitoring or public accountability or even these social audits, they have to be integrated into the design of these programs. And lastly, I would say where we also need the help of the community is to ensure redress mechanisms. Because a big challenge in the social sectors, and that's very frustrating for people, they don't have the time and energy for just simple things that a second teacher has not been appointed in the school. Now, what even you and I can't do very much in schools that our children go to if a teacher is absent or missing or not appointed. So that creates a sense of frustration and helplessness. And so if there are effective redress mechanisms, which the community also monitors and supports, then I think we can do a hell of a lot to ensure effective outcomes and social impacts.
So one more question, and this is a very interesting question about intersectionality. So the
Yeah,
question is, how can intersectionality become an important beating nerve for the development sector? So the people with disabilities, the elderly, children,
yeah,
the LGBTQ
yeah,
community,
yeah,
how do they become important stakeholders and not the others in the community?
yeah,
Maximizing the equal outcomes that come out of the projected impact, so to say.
yeah. So I think this is an extremely important question. And if you are coming into the development management, and I think one of the courses that the program offers is to understand this intersectionality, because it is not just about men versus women. So you could be a woman, and so you have a certain gender disadvantage over there. You might be from a Dalit community, so caste features in. You might be handicapped, or you might be having a handicapped member of your family. That is another intersectionality. You might be low income. That makes it another situation. And your sexual orientation might be quite different. So these multiple identities, and recognizing these multiple identities is extremely important. And so many times you will find that the most disadvantaged or vulnerable, or as the UN likes to say, they have this leave no one behind. So who are these people whom they're talking about under this slogan of leave no one behind, are essentially people who, because of these various intersectionalities of caste, religion, gender, sexual orientation, physical disabilities, handicaps, find themselves stuck. And very few programs, and in fact, that also is one reason why social purpose organizations are so important, that many government programs will not reach these people easily. And in fact, the marginal cost of reaching these people is very, very high. So we always say, for instance, suppose India has reached immunization coverage in India is, let's say today, about 70%. Who are these 30% who are left out, and how do you reach them? If you take an incremental approach, you will say from 70 to 75 to 80 to 85, 85 to 90. So in about 5 years, if 5 percentage points, you will increase. But let me assure you, you will never reach, because the strategies and measures that you have used have taken you up to 75, 80%, and that is it. So you really have to come from the other end of the piston and say, who are these 30% who are left out, and how do I reach them and design and plan for them? And I think that is the real challenge of intersectionality. When you recognize that the people who are left out are because of these multi-dimensional poverty dimensions of poverty and deprivation that they experience, and discrimination, and on various counts, that really makes a design of management programs much more effective.
Thank you so much, Professor Shiv Kumar. I think it was a pleasure attending this session, very engaging one. And I would also like to thank all our participants and attendees. Thank you so much for registering and then attending this session. There were a barrage of questions. I'm sure we were not able to answer all those questions, but to the best of our abilities, we've tried to club as many as and answer as many as we could. Thank you so much. Stay safe and stay connected with us for more such interesting and engaging masterclasses in the future. Good night.
Thanks to all of you. Thanks to all of you for signing in, and have a good evening and safe year ahead. Thank you so much for listening. Thank you.
Thank you.